a lot of applicants, they're applying for residency program in different hospitals across the country, but few I can say will be accepted in a well-recognized center. And this is, of course, will raise the questions how I can make myself unique, how I can improve my CV, what's the other skill I require to make myself attractive so I can be accepted in these places. One thing you need to consider is, of course, in the medical school, it's your chance to have a high GPA. So the GPA, I can say, it's one of the drive that make you different than the other who's applying in same center with you, but that will not be the only thing. Like having a good grade in the specialty you're choosing, like pediatric, also will affect your acceptance in the center. You're applying for pediatrics, your score is D, for example. And your GPA is, for example, let's say out of 5, 3.8. So that's considered like a very good GPA. But your score in pediatric is D. And you come and convince me in the interview, I like pediatric. It will not match. And for some circumstances, we can accept it. Like we know people who have reasons. Maybe you have a death of a close family member, you did not study well, you have difficulties. We understand, but you need to be ready to answer that questions. You want pediatric? You need to have a good score. Your score is not good, you need to defend that. Why you choose pediatric even though your score is not good. So that's talking about the GPA and the score of the specialty you like in the undergraduate. Another point is the SMLE. SMLE exam, it's an exam will test your overall competency in different specialty. Yet it's difficult, especially with the change in the system now. But it's not impossible for you to get a very high score. So please work yourself, prepare that, target a high mark. I think you can have a chance to do it once or two or twice before the interview time. So prepare yourself so you will have a high mark. SMLE sometimes can cover for the weakness in your GPA, can cover for the weakness in your grade, because you can convince me, yes, in the SMLE, of course, there is a grade for every specialty. So in pediatric part, in the SMLE, I scored full mark. So I will understand, yes, your pediatric was a desire you built in the last year in the medical school. You studied pediatric in the 5th year, then your grade improved. In the internship, you like pediatric, and you studied, you have a high grade in the SMLE. So this 3 aspects, it need to be covered. This is how we judge your academic career in the beginning. Second thing is how to write and introduce yourself. The first questions you will get asked when you enter the room for the interview is introduce yourself. So you need to know the way how you make yourself recognizable. I'm so-and-so, graduated from this university, graduated with this GPA, my SMLE score, my pediatric undergrad score. I love pediatric because 1, 2, 3, I involved in a lot of research. My research was talking about that. I know about the center. I target to work, for example, in King Faisal because I know it's the most recognizable center in the area. I asked some people. So you need to introduce yourself in the way that you make me convinced, yes, you like this place. After that, please, you need to know every single detail about your CV. It will be really bad if you put something and you don't know what is it. If you put a skill, you don't know what is it. If you put the research and you don't know even any single details about that research. So please know every single details about that. Don't put anything to impress people and you don't know what is it. One research can be enough. If you really aware and involved in that research, better than listing a 10 research and you don't know anything about it. If you love a specialty, try to do your elective on that specialty. Try to make your research in that specialty. You try to make your recommendation, which is really a fatal mistake, usually we are seeing it. People apply for example, a pediatric, but all of their recommendation is covering other specialty, which is bad. Sometimes even though we're not passed, so we'll not accept that resident. Major concern. He's lying. If he like pediatric, for sure he will do good in pediatric rotation internship and he will have a good recommendation. So why his recommendation all, for example, ENT, radiology, and he's applying now. So pediatric is not his first choice. He likes something else. This is again one of the things that can affect your CV, can affect your interview. In the interview again, please be yourself. Don't imitate. Don't try to do whatever away from your reality. Be yourself. So we can know you. We know how you are. Be prepared. There is a common questions, you will get answer. You know it. Ask the people who did an interview before you how I can prepare myself for the interview. Don't come depending, for example, on your GPA. Your GPA is 4.5 out of 5. You say, okay, I will be accepted in every well-respected center because my GPA. This is not the truth. I remember a lot of applicants with the high GPA talking about my center. They're not accepted in our center because in the interview, there will be a different person than what we require. We actually focus on the applicant as a whole, not only on a number. So the interview is very vital. Prepare yourself, know your CV, try to enrich your CV by having a research, workshop, certificates, recommendation letter. Write it in the way we can understand it. Make it simple. Don't use a font that we cannot read. Don't use a lot of diagrams. Make your CV readable. I think even putting a color is not required. So this will represent how professional you are. There is a lot of workshop, how you can write your CV or portfolio. There is a workshop how we can conduct an excellent interview. I recommend every one of you to go and join this. It will help a lot, and it will be a vital or a must to gain a very fruitful career is to have a skill to pass interview. I wish you all the best. Thank you.